If you suffer an injury like a fracture or a ligament, tendon, or muscle tear, and you wanted to use a peptide like BPC 157 to get it to heal, when would you want to start using it? In this video, I'll share my thoughts on the best use for musculoskeletal healing. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. This video is part of my Ask the Doctor video series based on questions you've left me in the comments to the videos on my channel. Here's the question from a viewer. I suffered a right ankle fracture a few days ago. When's the right time to start a peptide like BPC 157 to try to get it to heal as fast as possible? Two things real quick before I answer the question. One, like all my videos, I'm not giving specific medical advice in this video. I haven't seen you, I haven't examined you, looked at x-rays, MRIs. I'm not giving specific advice. Like all my videos, this is meant for information and educational purposes only. Also, I'm talking about a peptide, which in this case, BPC 157 peptides are considered experimental by the FDA. So I'm not telling you should do them. I'm not promoting them by any means. Talk to your doctor about that, but just understand this is trying to help educate about potentially what the use of BPC 157 in this type of situation might be. It's worth you talking to your doctor for specific medical advice about peptides and really any other treatments for orthopedic injuries. Having said that, whether it's a fracture, a broken bone, or a tendon, ligament, muscle tear, that type of thing, what a peptide like BPC 157 is trying to do, if you read the studies and look at the mechanisms of action, is trying to augment the healing process. It's not just a pain reliever. It's trying to get the tendon fibers to heal, the ligament fibers to heal, the muscle fibers to heal, the bone to heal. And it does that at a cellular level. If you look at the animal studies, at least on these, whether it's rats where they cut the Achilles tendon or something else, they were administered very soon, almost immediately after that injury, not months and months later. I'm actually not really aware of any animal or human studies on using these for chronic injuries that happened a long time ago, and now you're trying to deal with the pain and try to get it to heal. It's not to say that peptides might not work there. They might help in that scenario, but where they would seem to be better used is soon after an injury, while that inflammatory process is going on at the site of your injury, to try to augment that. And so again, that not necessarily something that you need, but it could be something that in theory could improve that. Again, we have very few human studies on that. So in terms of trying to get it to heal, what you're thinking is, all right, soon after the injury, you would potentially start, 24 hours or certainly within the first week. Again, it's worth talking to your orthopedic surgeon and getting him or her to potentially prescribe that for you if that's something that you and your doctor decided was the right way to go. But I would say if it was going to work, it's going to work better soon rather than weeks or months after the injury. Okay, I hope that was helpful. I wrote an entire ebook if you have osteoarthritis. I know that's not exactly what we're talking about here, but you can get that free. It's called the Arthritis Solution. You can get it by clicking the link in the description below this video. If you have an orthopedic injury and you want to hear about options other than surgery and other cortisone shots, I'd love to try to help. There's a link in the description below this video. It'll take you to my contact page on my website. Fill out that contact form and you can learn more about scheduling an appointment to potentially see me. I'd also love to hear your experience with your injury, whatever that injury is. Leave those in the comments below. Just understand, if you leave a question for me in those comments, I can't respond with medical advice. So what I typically do is consider it as a topic for a future video like I did here. Make sure to subscribe to this channel, click the bell to be notified when I release a new video and when I start my Ask Dr. Geier live shows. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.